So good evening. Today we are going to discuss what are the instruments required for the intubation procedure. Okay. So first of all, this is adult bougie and pediatric bougie, Stylet, and this is an lock screen for the uh, local anesthetizing agent. These are the drugs, emergency drugs and sedation drugs. Before we use this before intubation procedure. Okay, there are different types of drugs: midazolam, propofol, vecronium, scopolamine. So these drugs are used for the intubation procedure. So to paralyze the patient, we use them. Okay, and these are the syringes we use for the sedation procedure, sedation of the patient, and also to deflate and inflate the ET tube. So this is an ET tube, for example. So this is the balloon, and here we use the syringe to inflate and deflate the tube. So this is an LMA. These are a set of LMAs, and this is the main thing. So this is a laryngoscope, which is very important for the intubation. So this has three main parts. One is the bulb, a blade, and handle. So here there is an exchangeable part called blade. We can exchange it. There are four blades. Depending on the size. So this is Mac 4, and this is Mac 2 and Mac 1. So depending on the patient's age and depending upon the patient mouth size, we select the laryngoscope for the intubation procedure. So we should make sure that there are two handles. If one doesn't work, the other should be used. Okay. So, and we have to check the light in the working condition or not prior intubation. Okay. So once it is done, you can once you check it, you should be keeping it ready. We have to have two handles in hand for the emergency purpose. Okay. So this is the Hma filter. This is a cap mount which we connect the ET. So this end of the ET to be connected to this side of the mount, and this side we connect to the circuit of the ventilator. So this is an test lung. This is the circuit. Okay, and this is Ambu. So this is also one of the important things we need for the intubation. So Ambu has mainly three parts. This is mask, which should be which is changeable. We will get a pediatric mask also. This is an adult one. So we should while putting the mask, we should make sure that whole mask covers the part of the face and there is no leakage of the air while doing the Ambu. Okay, so this is the Ambu, adult one, and this is the reservoir for the oxygen, and you should make sure that it is connected to the oxygen before doing Ambu. Okay, so these are suction catheters. So this comes in different sizes. Suction catheters sizes start from 8 to 16. So different sizes are available, and these are tracheostomy tubes. These are available in three sizes here: 7, 7.5, and 8. This is mainly for adults. So these should also be kept ready during intubation. When there is a difficult intubation or intubation was not possible, we should be ready to do tracheostomy and put a tracheo tube. Okay. So this is suction vacuum suction. So this is connected to the vacuum suction, so that prior intubation we we do the suction to the oral cavity and inside the mouth to the oropharynx, so that everything should be visible during the intubation. So these are the intubation tubes. So endotracheal tubes we call this. So these are from the pediatric sizes to adult sizes. These are available from 2, 3, and 4, 4, 5, 5.5, 6, 7, 7.5, 8 and 8.5. So we have to choose the tube based on the patient. So each patient it varies. So for pediatric we do till 4 sizes. So that depends on the patient little finger or the thumb finger size. It's a rule. We see the sizes of the thumb or the little finger, so that we can confirm the intubation tube for the procedure. Okay, generally we use 7 to 8.5 sizes in the adult. Airways. Airways are from size 1 to 4. So 1, 2, 3, 4 sizes are available for the airways. We use the airways after intubation so that patient doesn't bite the tube or make any efforts to extubate by himself, moving his oral cavity, tongue and all. Okay, so these are in 4 sizes, and this is surgical glove. Okay, prior intubation we should wash ourselves, maintain aseptic precaution, and then use these gloves. So face shield is for the protection purpose, mask is also for the protection purpose, and this is a gown we should wear prior the intubation. And steps for auscultation post procedure, so that we should see both sides of the lungs are expanded equally. So yeah, these are the gauze, rolled gauze, so that this is used to tie the tube after intubation. So it can be shown on the mannequin. So this should be kept ready, which is a wet gauze, which is a wet gauze thread, and also a we should cut in two pieces like this. Prior intubation we should make sure this is ready. Okay, after intubation we use this to fix the tube. So this is kidney tray. For the suction purpose, or for any like bleeding is there, you can like use put NS and use it as a suction. For the suction purpose you can put NS in this and use this, and gauze also to clean the oral cavity or whatever the bleeding, if there is any bleeding or the external bleeding is there, you can clean it and use it. Yeah, before intubation you should also keep defibrillator near ready, and can be used when patient gets arrested. Okay, and the ventilator should be also ready, and we should prior check with a test lung. Before going to intubation we should make sure the circuit is intact and the test lung is tested, so that ventilator should be on standby mode prior intubation. Okay,